This video will run through how to use and put on your Cryocuff. The Cryocuff is an excellent device to reduce swelling in the knee, both after an injury as well as after surgery. The reduction of swelling is the key to progressing through a rehabilitation program, and so it is important to use any means to reduce the swelling safely. The quicker the swelling can be reduced, the quicker the rehabilitation process will progress, both after an injury as well as when recovering from knee surgery. The important thing when putting the Cryocuff on is to make sure that the sleeve which goes around the knee is empty. Never try and put the Cryocuff on when it is full of water. It is easier to put the Cryocuff on with the knee straight, and the first thing to do is find the top of your kneecap. The hole in the sleeve at the front of the Cryocuff goes around the kneecap. The nozzle which connects to the canister should be facing upwards towards your hip and your face, not towards the foot and ankle. The top of the hole at the front of the knee sleeve goes at the top of the kneecap. There are two straps used to fasten the Cryocuff on the leg. The one above the kneecap can be pulled relatively firmly, but the one below the kneecap must be kept loose, otherwise your calf will swell as the Cryocuff tightens up. Once the Cryocuff is on the leg, the nozzle at the top of the sleeve is connected to the canister, which has a mixture of ice and water in it. Once the canister is connected, the nozzle on the lid at the top of the canister must be opened in order to allow flow into and out of the Cryocuff. It is then simply a matter of gravity, in that the canister is lifted above the level of the Cryocuff and held there until the Cryocuff feels tight and is filled with ice cold water. Once it is full, the nozzle can be disconnected. It does not need to remain connected to the canister. The water in the sleeve will stay cold for about 20 to 30 minutes. At that point it can be exchanged back with the ice cold water in the canister. This is done by connecting the tubing to the Cryocuff sleeve. The canister is then placed on the floor, so it is below the level of the sleeve and the nozzle opened. The water will then flow out of the sleeve into the canister. Once the sleeve is empty, the canister is then shaken to mix the water from the sleeve with the ice water in the canister, and the sleeve can be refilled as described previously. The other method of emptying the sleeve is to take the sleeve off the knee once it is full, connect the nozzle to the canister, open the nozzle and hold the sleeve above the canister so that the water flows out. Once it is empty, the nozzle is disconnected and the sleeve can be reapplied to the knee empty to then be filled once again.